together using sterile technique. You're going to have different types of wounds and all kinds of different things you're going to have to do. Sterile technique is not used that often anymore because they found that clean technique is almost as effective. But you have to be able to leave block one, knowing how to do something in a sterile technique. Okay, so you're going to either do the Foley catheter, which I'm going to demo to you this afternoon, or you're going to do a sterile wound dressing. Okay, so follow along, make any notes in your book that you want to, and then we will go move forward, and I'll do the best I can with kind of this area here. So you guys that are way in the back, you probably won't be able to see anything. So I would come to the center, or as long as you're down, you know, just so that you can see that. Okay? And this isn't ideal, but at least it's on a little tilt that you guys can see this. So, so the first thing I want to do is I want to come in and I want to, I'm going to gather all my supplies that I need. So I'll make sure I have everything here. That's what I want. Bring into my.
Someone right up in the front records it. Last semester,
yep.
Someone had a good recording. We posted it right on our
campus. So, and we have another that still is up there. So I've got all my supplies. Knock, knock. Hi, Mrs. Bellman. I'm Kathy. I'm your student nurse. I've got a dressing change to do this morning. And what I'm going to do is going to provide for privacy, wash my hand. You'll have an order, so I'll positively ID her using our identifiers and you know, her name, date of birth, and does she have any allergies. And then I'm going to do another assessment right now. I'm going to ask her what her pain level is on a 0 to 10 scale. 0 being no pain at all, 10 being the worst pain you've ever had. And then I'd also want to check to see when was the last time she was medicated, because these can be painful. So we want to address the patient's pain first. So if she's getting oral pain medications, how long should I wait after I give her the oral pain medication to start this procedure? Yeah, about a half hour, because it doesn't start to kick in until about 20 minutes. IV is right away. IM is about 10-15 minutes. So we want to make sure her pain. So she's going to tell me she was just medicated for pain. Her pain's at a 0 to 1. So I'm going to go ahead and get started with that. So the first thing I have to do is I've got to put on my clean gloves, because I've got to take off the old dressing. And then these are in your week this week, you guys, so you can follow along with that. So I've told her what I'm going to do, and then I'm going to go ahead and I've already washed my hands, and I'm going to take off the old dressing. So I just want to go around, loosen all the edges if I can. And then how I like to work is, so let's say my patient is laying this way. I'm going to see her face here, because I want to see if she's grimacing or having any problems. Plus, I think it's rude to work like this to somebody.
We saw that today, right?
So I want to talk to her. I want to see how she's doing as I'm going through this. So I'm going to take off the dressing, and what I need to do then is I need to observe a few things. So I need to observe the odor, the amount of dressing there, or drainage, I'm sorry, the amount of drainage, the type of drainage. Is it purulent? Is it serosanguinous? Is it sanguinous? And you'll learn all those terms coming up. We want to give you this skill, so if you have a chance to do any wound care out in long-term care, you'll be able to do that. And did it soak through the bandage? And what when I'm doing this, I'm bringing this and pulling it this way. The patient doesn't need to have that in their face, okay? So pull it this way and then observe it that way. So after I've made all my observations, I'm going to go ahead and I'm going to throw that out. And then I need to measure my wound, okay? And we have these little wound care measuring guides, and each patient usually has one in their room that they keep with them if they've got a wound like this. So, so I'm going to go ahead and measure this, and we measure the length first, and that is 10 centimeters, and you notice I'm not sticking this in the wound, I'm hovering above by 2.5 centimeters, and now I got to check to see what the depth of it is. So I've got my little sterile Q-tips here, and I'm going to go in, and all I'm going to do is I'm going to place it into the wound and come approximately over to where that comes out of, and that is 1 centimeter deep. So I have 10 centimeters long, 2.5 centimeters wide, 1 centimeter deep. then I'm going to go ahead and get rid of that. I don't need this anymore. This will stay in the patient's room. I'm going to take off my gloves, and then I'm going to re-perform my hand hygiene. Okay. Now it's time for me to, did I do that right? Did I follow the steps correctly? Make sure I did. Okay, good. All right, so now I got to set up my sterile field. So I'm going to take off anything that doesn't need to be on this tray table, because this is hard for you guys. A lot of times you've got so many things here, it's hard to imagine. So we have to make sure that we just can't pour the solution right on top of the sponges, because it'll leak through. If we had the plastic bottom sponges, then we'd be able to pour the solution in. But for now, we're going to continue to just use these. So, so I've got my sponges, I got my tape, I've got my sterile gloves, I've got my container to put my sterile water or sterile normal saline in. So the first thing I want to do is I want to get my sterile water prepared. So I'm going to go ahead and open that up. I'll put the cap off to the side. And then I gotta I'm gonna make sure my water's not expired. And then we still are doing something we call lipping the solution, you guys. We're pouring off a little bit at the top in case there's anything hanging on there. Now I want you guys to fill it as full as you can, because it's a lot easier and you have a less chance of contamination. So now I can put this off to the side. Now I have to create my sterile field. So I need to open up my gauze sponges, and I believe I have you use 3. I don't remember for sure. So it is 3. Yeah, that's what I thought. So, and so how you want to open these up, guys, is you want to go ahead and get your thumbs all the way across. Okay, all the way across. It gives you better leverage for opening these gauzes. Now, this one went over the edge. Would I want to use that yet?
No.
No, I'd throw it out and I'd get another one. And these, so we'll see if this one comes out any better. Okay. And what I'm careful to do is I'm careful to touch my 1-inch border only, okay? And I'm not crossing over. Okay, the next thing I'm going to do the next gauze. I'm going to do my next gauze. And you see me kind of moving down the line here? This is the easiest for you guys to do that. And then I got my final one that I'm going to place on there. So let's say, I think the tray tables in the lab are a little bit smaller than this one. This is an older style one. Right now, what you guys can do is you can go ahead and you can move this gauze up here if you need to, in order to give you more space to open your sterile gloves. Now, I got to make sure I'm all ready to go before I put these sterile gloves on, right? I shouldn't have to open up any other packages or anything like that. Gloves. I can fix. Okay, so now I'm sterile. So the first thing I have to do is I have to clean the wound. Okay, so I'm going to pick up my gauze, and I'm sterile, so I can hold there's 2 gauzes in here. So I can hold my other gauze in this hand while I work with this one. Okay, and then I'm going to make what I call a little wonton. Okay, and I'm going to dip it in the solution without touching the edges. And so what I want to do here is I want to go ahead and I want to clean the center first. Then I'm going to get rid of that. Make another wonton. clean the side. Get rid of that. I got one more cleaning to do. I'm going to clean the other side. All right. And just depending on the wound, you might have to do a lot more than that. But that's for our wounds that we have here. That's what we have you doing. So now the next one I'm going to have to pack into the wound. So I want to expand it first, because once you get this wet, it's really hard to pick at it to get it open. And then I'll crunch it up. And I'll put it in my solution. Get it nice and wet. Okay. And I'll open it up. And I want to lightly pack this in the wound. Okay, so I'm going to lightly pack in the wound. And this is a little bit more shallow, but the wounds we have in the Bellmans will take 2 of these gauze. So what I was very careful of doing was not crossing over my gauze initially. I don't know if you guys noticed that or not. So, but you can't let your arms cross over. Think about like little buggies falling off your arms, little bacteria or whatever. Okay. All right. And we want to pack so that you have all the nice pink moist granulation tissue covered and not a lot hanging over the edges. So I have 1 gauze left, so I'm going to just cover that, and you can cover it any way you want. This covers the whole angle there. And then now I can cross over this area, you guys, because I've already got everything gone. So this is Surgi pad or ABD pad, and you want the blue side on the outside. Alright, so now it's really hard to tape with gloves on. You've got everything covered, you're all set, so you can take your gloves off at this time unless there's a lot of oozing or you're afraid that you're going to be exposed to blood or body fluids. So go ahead and take your gloves off, and then now I need to tape. What we're going to do is call it a window pane. So we just go around. And because of this example of a wound, I might not get every corner down. And then what I'm doing, you guys, is I'm leaving little tabs at the end. I think there's nothing worse, because what happens is the patients sweat and this paper tape almost like melds to them. And there's nothing worse than a nurse going like this to you. It drives me crazy. And use plenty of tape to make sure that you've got it on there. Now, if this was in the fold, in somebody's belly in the fold, I would also tape across wherever that fold is. You know, I want to make sure I use enough to keep it on. But this is fine for our example here. Then the last thing I have to do is I have to mark down the date. So 3/1/16.
I thought it was 3/1.
It is 3/1, yeah, and it's 10 o'clock, and my initials. Okay. And then I'll place that on there in the corner in case the wound drains and it gets saturated. You can still read what that is. Okay. What I don't want to see you guys doing is going like this and writing on your patient.
Hold still, Mrs. Smith.
Yeah,
I
hold
gotta
still.
write.
I'm going to write on you with
That's
my
rude.
Sharpie. It's just rude, yeah. It's just rude. You'll see people do it too. So, okay, and then I'm going to have to document. So, questions so far with this procedure. Main thing is set up your entire field. Do not cross your arms over. Move your feet if you need to. Have your product, have everything up waist high or higher. Have your trash handy. And just be careful that you just don't go over or you don't touch your gloves to the side of this. And this takes practice, you guys. This takes practice. Because your natural tendency is to want to come and work like this while your other gauzes are here. So remember, you've got to kind of work to the side like that. All right, so let's pull up the documentation guidelines.
It's important to go a certain way when you're taping, right? Or like
Well,
Like
what
one
she
of you
did
from
was
side
window
to
pane, she
side.
just went around all the four sides.
Okay.
It doesn't matter if I start like top,
No,
bottom, side,
that's
side.
fine. And just use enough tape that it will keep the dressing on and keep it secure, but your patient won't look like some Christmas present where there's so much tape all over. Sometimes the tape gets really irritating.
Kathy,
Yes,
so after you got sterile gloves to grab your dressing?
Yes.
So you use sterile gloves and you apply the new dressing, or you just?
No, those are fine, because that's the patient's own flora. I'm just not introducing anything new to the patient. That's why we have the sterile gloves on, so, yeah, no need to double sterile glove like that, so. Jason?
What about the people who have a adhesive allergy?
Then we will get a different type of tape for them. There's some tape out there that is for, it's hypoallergenic. So, because paper tape isn't the best for everybody, so. So what are you gonna have to document? The date and time. What packings or dressings did you remove? Remove 2 4x4 gauze from the wound. What kind of drainage was present? Moderate amount of serosanguinous drainage. Was there any odor to it? An odor might signal